Welcome to my presentation. My name is Dr. Sharon Lambert from the School of Applied Psychology in University College Cork in Ireland, and I'm involved with some speakers. So what I wanted to think about was, why do we need to have trauma-informed practice in all public services? So I'm a researcher who works in the psychology department in a university, and prior to that I worked in several community-based organisations with lots of different people, and one of the things that we realised quite quickly was that psychological trauma is something that happens to lots of people. And in order for us to ensure that the people who need our services the most can access them, we have to design our services for everybody. So the groups of people that I'm particularly interested in terms of research and looking at psychological trauma and how we can design systems and services to meet with their needs are young people, members of the travelling community, people who use drugs, people experiencing homelessness, and also frontline workers. What are their experiences of their own personal traumas? What are their experiences of secondary traumatic stress? And how can organisations respond to that? So in terms of adversity during childhood, we know that adversity during childhood can impact on a child's social, emotional and cognitive development. When I think about adversity during childhood, or ACEs, when I think about what is an ACE is anything that occurs in your lifetime that impacts on your development, or impacts on your ability to get your needs met and to stay within systems and services that you require. So in terms of why do services need to think about this? So we know, that the impact of stress and trauma on the brain means that your fight or flight system is activated. And when that's activated, it causes blood loss from the prefrontal cortex. So blood withdraws from the prefrontal cortex so that you can respond to the trauma or the stressor. So I'm in danger, I'm driving in my car and a deer runs out in front of me, my brain will activate my fight or flight response system to keep me safe. And in that moment, it withdraws blood from my prefrontal cortex, which is my thinking brain, my brain that helps me to analyze problems and learn ahead and learn from experiences. So sometimes when people present to our services, they present in chronic levels of stress, and everything that's required to be able to navigate our service, particularly our prefrontal cortex, is just not online in the way that it should be. And, you can have people who can be quite emotionally dysregulated. They might appear to be aggressive, but in fact, they're doing exactly what they should be doing because they're quite traumatized and quite stressed out. What happens in many instances, of course, is that services exclude them from the system. Then they say, look, we can't have so-and-so come into our service because we can't deal with their aggressive behaviour. So what happens in reality is that the people who need us the most struggle the most to access the services that they need, because many public services are not set up to understand what's going on. So here's in relation to women in contact with the probation service, we found very similar profiles, so much higher levels of childhood adversity than within the general population. Issues around mental health and addiction, which of course are responses to trauma. So we have to stop thinking about people in the criminal justice system who are in addiction as having, as having some kind of a moral failure when it comes to being in addiction. These are people who are trying desperately to medicate their emotional pain, and substances work very well to do that. They medicate people's emotional pain. That's why people continue to use them. And unfortunately, they no longer work. Those substances don't work the way that they did the first few times that people started using drugs and alcohol, and then it becomes a problematic level, is sometimes the reason why they're involved in crime. So we have to stop viewing that substance use issue as a criminal issue. It's a response to trauma and a response to mental distress. I won't talk too much about this because Aoife Dermody from Quality Matters is going to talk about the study that we did, and Chief Superintendent Colette Quinn from An Garda Síochána will also talk about young people in Ireland and their levels of adversity. But what was interesting was that they're young people who are involved with the criminal justice system in Ireland. Their ACE profile is more similar to adults experiencing homelessness than it is to the general population. So we have to think about the systems and services that are around young people and what we can do more to design those services so that they can hold young people who are struggling. So the education piece is a perfect example. The longer we can keep young people in education, the better the outcomes for them. But there are too many young people who fail to stay in education because the models are not set up to keep them there and keep them emotionally safe. And how do we know that young people feel like that? Because when we did a study where we talked to young people who were using high numbers of illegally sourced benzodiazepines, what they told us as the primary reason for taking those, it wasn't, for fun. They weren't going out at weekends having fun and partying and using benzodiazepines. They were using benzodiazepines because it helped them to just not feel. It helped them to medicate the emotional pain that they were really struggling to manage. Having a trauma-informed service. Something that's that I think is really important about saying about trauma-informed services is that that's a journey that you need to get to. It can take years for some organisations to become trauma-informed. Maybe you don't want to be trauma-informed, maybe you just want to be trauma-sensitive, but it's really important to know that attending a 2-hour workshop on an introduction to trauma does not make an organisation trauma-informed. That makes you trauma-aware, and you need to go through all of the other steps. So how do we respond then? So if we want to respond so that we can support service users with high levels of trauma and we can support our staff who may be experiencing secondary traumatic stress from the work, we need to have an organisational culture that understands and respects the fact that some people can present as challenging. It does not mean that they are challenging people. It means that they are experiencing their world in quite a scary way. And making sure that you have appropriate supervision. This is not line management. Supervision is not line management. Supervision is a reflective space that is a safe space for staff to be able to explore the impact of the work on them. And that would include reflective practice sessions. By looking at your organisation and seeing what can you do to make it, if you can make it more trauma informed, at least more trauma aware or more trauma sensitive, it will cost you less money in the long run. If you have an organisation that's better equipped to serve its service users and its staff, trauma informed organisations, and Aoife from Quality Matters might talk about this, they evaluated a project that it's a shelter for people experiencing homelessness, and they implemented trauma-informed practice there, and they had a reduction of 60% in the number of incidents that were reported. So it makes the workplace less stressful, which means that you're going to have rewards then in terms of staff sick, staff turnover, other HR issues, etc. And by practicing self-compassion and having an organisation that promotes self-compassion. Thank you.